Hello dear students, here I am with my next video, and today we are going to see humerus. Humerus, it is the bone of upper limb, and it is the longest and strong bone of the upper limb, arm region. It lies in the arm region. Okay, so first of all, the side determination of humerus. See, the upper end of humerus has head. Upper end has head and it is directed medially. Okay, and lower end is expanded and having two epicondyles. This is the lateral epicondyle and this is the medial epicondyle. So the upper end has head, it is directed medially, and lower end has epicondyles and it is expanded side to side. So, and another is the lesser tubercle is present on the anterior aspect of the upper end. So this is the bone of the right side. If I hold the bone like this, the head is coming on medially, but the olecranon fossa is coming on anterior side. So it lies on the posterior side. That's why this is the bone of right side and not of the left side. Okay. After that, the gross features of the bone. As every long bone, it has upper end, shaft and lower end. So upper end of humerus has head, anatomical neck, lesser tubercle, greater tubercle, intertubercular sulcus or bicipital groove, and the surgical neck. So one by one we will see the head. The head is more than half sphere. It is rounded. It is directed medially upward and slightly backward. Medially upward and slightly backwards. Okay, the directions of head are very necessary because the head get articulate with the glenoid cavity of the scapula to form the shoulder joint. So the margin or the head which separates head from the rest of the upper end is called as the anatomical neck. The line which separates head from the rest part of the upper end is called as the anatomical neck. Then this is the lesser tubercle or prominence, which is present on the anterior aspect of the upper end, is called as the lesser tubercle. Okay. Now this is the greater tubercle. Greater tubercle, it is mostly present on the lateral aspect of the upper end, and on its posterior side it has three impressions: upper, middle and lower, for the muscles attachment. In between these two tubercles there is a bicipital groove which has medial lip and lateral lip, and this bicipital groove is also called as intertubercular sulcus. Okay, this is the floor of the bicipital groove, and this is the medial lip, and this is the lateral lip. Now the narrow line which separates upper end from the shaft is called as the surgical neck, and it has surgical importance because the axillary nerve is enrolled along the surgical neck. That's why it is important, and always it can fracture, so axillary nerve get injured. Now the shaft has three borders and three surfaces: the anterior border, the lateral border and the medial border. Three borders and three surfaces: anterolateral surface, anteromedial surface and posterior surface. Now see, the anterior border starts from the for the convenience of we divide it in the three parts: the upper part, middle part and lower part. The upper part of the anterior border, it forms the lateral lip of the bicipital groove. Okay, so lateral lip of bicipital groove forms upper 1/3 part of the anterior border. The middle 1/3 forms the anterior margin of V-shaped deltoid tuberosity. This forms the anterior margin of the V-shaped deltoid tuberosity, and lower 1/3 it is ill-defined or rounded and smooth. Okay, so anterior border starts from the this lateral lip and goes downwards, and it is in its lower part it is ill-defined. Okay, now the medial border in its upper part, it starts from the medial lip of the bicipital groove, goes downward. In its middle part, it is in the rough strip. Okay, here it looks it is a rough strip. Its lower part, it is well defined and forms the medial supracondylar ridge. This is the medial supracondylar ridge. Okay, it is well defined. In its lower part, it is well defined. In its upper part, it is rounded. It starts from the medial lip of the bicipital groove. Now the lateral border again starts just below the lowermost portion of the greater tubercle, goes downwards. In its middle part, it is crossed by the radial groove. Okay, and its lower part, it forms the lateral supracondylar ridge. This is the lateral supracondylar ridge. In its middle part, it is crossed by the radial groove, and its upper part, it just below start below the lowermost impression of the greater tubercle. Okay, so in this way we have seen the three borders: anterior border, medial border, and lateral border. Now the surfaces. The surface between anterior border and lateral border, it is the enterolateral surface, and enterolateral surface has V-shaped deltoid tuberosity in its middle part, and which receives the insertion of the deltoid muscle. Okay, now the medial surface, it lies in between anterior border and medial border. So this is the medial surface. In its upper part, it has a nutrient foramen. Okay, so the posterior surface, it is present between medial and lateral border. This is the medial border, and this one is the lateral border. In these two borders, this is the posterior surface. In its upper part, it is crossed by the oblique ridge. This is the oblique ridge. See, slightly black in color. In its middle part, it is crossed by the radial groove. Okay, here the radial now passes the posterior surface, middle part of the posterior surface, and this is the lower part of the posterior surface. Okay, so posterior surface present between the medial and lateral border. So in this way, this is the shaft, all about the shaft. Now the lower end of humerus is expanded side to side to have the epicondyles, medial epicondyle and lateral epicondyle, and it is divided into articular and non-articular parts. The articular parts are only two, and that is this is the pulley-shaped trochlea, and this is the capitulum. The pulley-shaped trochlea is there. This is the trochlea, which get articular with the trochlear notch of the ulna during flexion of the elbow joint. Okay, and this is the capitulum, which get articular with the head of the radius, concavity of the head of the radius. The superior surface of the head of radius has the articulation of capitulum. So these two parts are only articular, and remaining 7 parts are non-articular. So which are the 7 parts? The medial epicondyle, the lateral epicondyle, the medial supracondylar ridge, lateral supracondylar ridge, then the coronoid fossa above the trochlea. This is the coronoid fossa. Above the capitulum, this is the radial fossa, and posteriorly this is the olecranon fossa. Okay, so these are the non-articular parts of the lower end: medial epicondyle, medial supracondylar ridge, lateral epicondyle, lateral supracondylar ridge, then coronoid fossa, radial fossa, and olecranon fossa. 3 fossas and 4 parts. Okay, so medial epicondyle, if you feel, it is quite larger than the lateral. And what is the importance of medial epicondyle? Behind it, or on the posterior surface of the medial epicondyle, you can feel the ulnar. Okay, right from this. So ulnar, and that's why there is a clinical aspect at the student's elbow. Okay, so applied part of the humerus is the fractures at the shaft. Fracture is at the middle of the shaft, lower 1/3 of the shaft at supracondylar lines. It often get fracture. So humerus is the important bone of the upper limb and arm region, and it forms the two joints, the shoulder joint along with the head glenoid cavity, and head of humerus articulate with the glenoid cavity of scapula, and at its lower end it forms the elbow joint, okay, along with the radius and ulna. So thank you students, keep watching videos, and if you have any queries you can WhatsApp me on my personal number which is given in the description box. Thank you.